is Nesta McGregor.
BBC Three Counties Radio.
Time is already flying past. It's already 8:30. Nesta McGregor is my name. You're listening to Three Counties Radio. I'm with you all the way up until 10 o'clock tonight. If you're watching the football with me in the background, enjoy. It's been absolutely fantastic World Cup so far. So many shocks. Costa Rica and Italy, I think it's been the biggest so far. And boo-hoo-hoo, England. I was English for about 2 weeks. Now I'm back to being Jamaican, safe to say. Come on, Jamaica, whenever the next one is. Anyway, we just played you some Aretha Franklin and some Isaac Carey in the background before that. Going to get into some Blackstreet and some Jimmy Riley before I leave you. But right now I've got my next guest in the studio because a scholarship is available to study at the University of Bedfordshire, which helps international students come to the UK to learn skills to take back to their own countries. Opeyemi Ezekiel Akindele from Nigeria is studying for an MA in Public Health at the university thanks to the scheme and is in the studio now. Good evening, sir.
Yeah, good evening.
How are you?
I'm fine.
We just spoke about football and you being a Nigerian. Things are going well then?
Well, Nigeria is a country that loves football.
Mm-hmm.
Football, we're passionate about it. And so we're happy to defeat Bosnia yesterday. So we're very happy.
Yeah.
And we hope we'll go far.
Yeah, and you've only got the small country of Argentina and Lionel Messi stopping you from going through. So what do you reckon, win, lose or draw?
Well, I think we might beat Argentina.
Okay.
If we're not playing a draw, we might just beat them.
Okay, now you're a clever man, so I can't even have a go at you because you are this clever. What made you then want to take part in this scheme, come over to Luton to study public health? How did the opportunity come about?
Yeah, the United Kingdom, it's of course the leading destination for Nigerian students, especially pursuing degrees, postgraduate degrees.
Mm-hmm.
For me personally, 3 reasons underpin why I decided to pursue my postgraduate in the United Kingdom.
Yeah.
The first is global intelligence and cultural competence. Global intelligence in the sense that when you come to the UK, the postgraduate experience is rich.
Mm.
And, the United Kingdom, I think, is the most multicultural country in the whole world.
Okay.
So coming here for me is like coming, to the entire world.
Yeah.
You meet people from India, America, Pakistan, Nepal, Ghana. So, for that reason, and considering the fact that career progression these days does not rely solely on technical brilliance, but also on your ability to interact with people from other cultural or religious backgrounds. So for that reason, the second reason is there's a pharmaceutical balance, I'm a pharmacist, which we call rate determining step.
Yeah.
For me, coming to study in the United Kingdom is a rate determining step in my career, as a pharmacist, as a public health professional.
Is it seen like a badge of honor then? The United Kingdom is a great place to study and a great place to get education.
It is really, I talked about the rich experience, so then, you have contact to see how they do things, so it's, for me, a rate determining step in my career. Then the third reason, like you said, massive funding opportunities, they're available in the United Kingdom. I came in as a Commonwealth scholar. I applied for a Commonwealth scholarship, and I was lucky to be given the chance by the University of Bedfordshire. And I tell you, it's very, very competitive. You've got to have a first class. You've got to be able to convince the professor that you are capable, you're prepared.
That you're going to be of benefit to
your own country and of course to the scheme.
I mean, what are the fundamental differences then between the schooling you received in Nigeria and over here?
Yeah, well, the fundamental difference, I'll first talk about what it is not. It's not about the brilliance of the personnel. I tell you, we've got very brilliant people, researchers back in Nigeria, my own lecturers, they've won international awards.
Yeah.
But the difference is in terms of the facilities, you know, the experience.
The equipment, you talking?
Exactly, how rich is the experience, you know. Then about, you know, we do have strike actions. My pharmacy degree should have been for about 5 years, that's 10 semesters, and I spent a little above 6 years.
Yeah.
You know, those are some of the issues.
Who was striking then? Your lecturers and your teachers?
Sometimes it could be the non-academic staff. You know, we do have those issues, but all in all, we have you know, the good and very brilliant personnel, at least generally speaking. So.
Okay, well, tell me about healthcare in Jamaica then, in Nigeria even, because I was going to say here we have what is considered, you know, the best healthcare in the world, the NHS. You know, if you're ill, you can turn up to a hospital and they'll treat you. In Jamaica, where I'm from, if you're sick and you don't have money, you die. So what's it like in Nigeria?
Well, the health system in Nigeria, well, I'm sure we share similarities with other developing economies, especially low-income countries like maybe Pakistan, Ghana, and the rest. Well, I will start from the positive aspects. We've come a long way, you know, especially in terms of the Millennium Development Goals. And specifically, I could talk about infant mortality rates, you know, compared to the 1990 levels where we had, I think, above 180 deaths per thousand of kids between the age of 0 and 5.
What diseases?
But currently, you know, we've been able to move it down at national level to about 120. Well, we've still not made the target as a nation, but if we disaggregate the data, you realize that southwestern Nigeria, where I came from, we've met the Millennium Development Goals. But there are other parts of the countries, especially in the north, where, you know, the infant mortality rate is nearly twice as what we have in the south. So in that aspect, I think we've been able to achieve something. Then with regards to universal health coverage, because that's what you're trying to talk about, well, recently the Federal Ministry of Health, and I think it's part of the transformation agenda of Mr. President, trying to cover as much as possible people who are not even civil servants, to get them on the National Health Insurance Scheme. So I believe that would, you know, go a long way. But in terms of the challenges, you see, we have people who are capable, but the system, you know, system has to do with how we function as a whole.
The system's not making the most of the brilliant people you have.
Yeah, exactly. The system is weak, and I will talk about the fact that the average Nigerian does not trust the health system. I'll give you a classic example. Before I walked into this studio, because I always keep myself abreast of events, political events happening in Nigeria. The deputy governor of Adamawa State, a northeastern state, one of the northeastern states, he just returned from Dubai, and guess what? He went there for a medical check. I mean,
so your own politicians are not using your health system.
Exactly. That's the point. So, and you find an average Nigerian, you know, until we're dying or things are getting out of hand, that we just see we see the hospital as the last resort.
Why is that fair though? Why?
Yeah, it's unfair because the politicians, if they take the issue of healthcare personally, this is like, I'm going to use this same service, so I'm going to make
all equal.
You understand? So there's a mistrust, you know, among people. I'll give you an example here. I've personally met the British Member of Parliament for Luton North, Mr. Kevin Hopkins. I've met him twice in healthcare promotion settings, and recently the Luton Council organized a Men's Health Week, and this guy was there, you know, a parliamentarian, you know, of one of the top countries in the world. You know, he engaged people in his constituency. He talked to them about how he has made a habit of going to the doctor to get himself checked if he notices any abnormal changes in his body, how he does exercise. You know, someone of that caliber telling you, member of his constituency, how he uses the health. So definitely
we have similar things here where you might have you know, celebrities, you know, do prostate cancer drives, you know, where they'll say, look, I've been to get my prostate checked out, why don't you go and get yours? And it's just seeing that things can affect everyone and we all use the same systems. But it sounds like then you have the brilliant doctors, you have the brilliant teaching, you have the brilliant teacher. So it sounds like a lot of it is to do with the government and infrastructure. So are you learning how to go back and change that and affect people as well?
Yeah, definitely. But before I come back to that question, if you permit me to talk about two more issues that are...
Quickly, yeah, but you need to answer that point, that's right.
Yeah, I'll come back to that question. There are developmental issues and poverty, because studying public health has, widened my horizon. I'm able to understand the different factors that determine health.
Okay.
And you can't separate development from health. So in a situation where, people barely eat once a day and they're taking medications, so it's not going to work. Their health will not really improve.
You need nutrients and exercise, and it's all more like living as a whole.
Exactly. So, and the third point I was going to say is regulatory issues. You find people who are selling antibiotics, who are selling antihypertensives, and they're not qualified pharmacists. And the government has not really been able to stop all that. So these are some of the issues we have.
I mean, it sounds like you should have almost been like a politician then, rather than a doctor to make these changes.
I'm a pharmacist. Yeah. Well, you see, everything goes hand in hand. As a public health student, we're told that public health is the politics of health.
Yeah.
So you can't really separate, advocacy, politics from healthcare. So I'm building my political career also, little by little, and we get there.
I mean, is this all funded by us, should I say, as in the UK taxpayer, or did you have to spend any of your own money?
Well, you mean the Commonwealth Scholarship? Yeah, it's fully funded. The pathway through which I came is funded by the University of Bedfordshire and the DFID. That's the UK Department for International Development. So it's a partnership between the hosting university and the UK government.
Awesome.
So there's no cost implication on my part.
Awesome. Thank you very much. We've run out of time at Opeyemi, but thank you, and hope you go back to Nigeria and make those changes that you envisage making. That is excuse me, need to take a gulp. Opeyemi Akindele is from Nigeria. He's a student studying for an MA in Public Health at the University of Bedfordshire, thanks to a new scheme. Right, 8:45 before 9 o'clock. Don't go anywhere because I'm going to play you some Pharrell Williams and some Jay-Z as well. But right now, let's get into some Bob Marley.